Hey, everybody. This is me again. I have Dr. Joe with me here today, and we're talking about some more optimal human experience. So this guy is really quite brilliant. Hopefully we touch on all of the stuff we talked about today. Anyways, he is going to talk about Oriental Diagnosis. And so why don't you take it away, Joe?
Well, Glenn Fern, my privilege and pleasure to be back here with you. I just ate a large cupcake full of sugar and white flour, so I'm well qualified to talk about health problems in America these days. Way back in 1973, 74 era, 75, Richard Nixon went to China and he did some trade things. And when he came back, he brought some doctors of TCM, traditional Chinese medicine. And I was in chiropractic college at the time. And when we were introduced to traditional Chinese medicine, it was as if they had shown a light in a dark room. And there are 4 different kinds of diagnosis in traditional Chinese medicine. But my favorite is Bo Shin Jutsu, where you diagnose by visual observation. And it all makes perfect, intuitive, good sense. When you see a person who lives on mashed potatoes and biscuits made out of white flour, it's no stretch of the imagination to think that they probably have a little problem with their bowel. They have a little constipation going on. And when you look at the mouth, it's the opening of the digestive tube, and the lower lip reflects the lower digestive system. And if it's swollen and blue from venous blood with not much oxygen in it, it's not hard to think, well, this person probably has a little problem with their colon. Now, I remember when I was taking my board examination in New York City for licensure as a chiropractic physician in the state of New York, I went to New York City, I got on the train, and I went into shock because everybody had a swollen nose. They had lower lips sticking out. They had lines in their faces, and I had never noticed it before.
Oh, wow.
I had never noticed, and I was looked with horror, and I realized just how ill as a society we had become. And the Oriental doctors back then said, boy, we're going to pay a terrible price for neglecting our health, neglecting at least a little harmony with nature. Eating too much refined foods, too much sugar, too much white flour, things like that. Ultimately, the number of people with cancer and diabetes and arthritis and all of these various degenerative diseases is really through the roof.
Yeah, we do have an epidemic of all sorts of these kinds of diseases today, and some people say that cancer is a virus, and it could be. I don't know that much about it, but I know that I have always been into, if I have bread, I like the multi-grain bread, the 21 separate grains, the whole kernels. It just tastes better to me. I can't stand white bread, although sometimes when you buy something like some rolls or something, it's going to be white flour. But I certainly am not in the habit of eating a lot of that stuff. And I try and keep things moving nice and smoothly, as in going to the bathroom. And I don't, if I get constipation or something like that, I do everything they can to prevent that kind of thing from happening.
I was going to patent an herbal-based laxative, and I was going to have it made up into tablets, and I was going to call it blasting caps. And I was going to have a free seatbelt included with it that you could bolt down on either side of the toilet. Take blasting caps and never be constipated.
You'll never have trouble with that, eh? That sounds like that Dr. Schultz's digestive formula #1. I'll tell you, what he says is if, like he says, his first, whenever he talks to anybody, he says, the first thing he asks them is, when's the last time you had a bowel movement? And sometimes he says it's amazing how many times people will say 3 months or something like that.
Does he say hello first? Does he introduce himself? Or does he just walk up to people and say, when's the last time you had a bowel movement?
I don't know. That's when he's visiting them as a patient, I suppose. And so I'm sure there's a little bit of introduction there and everything.
At the turn of the last century, around 1900, if the medical schools had somebody who came in with cancer, they showed all of the interns. I almost said inmates.
Yeah.
they showed all of the interns because it was so rare that they said you might not ever see another person with cancer like this again.
Wow.
How different are things today?
Oh, man, no joke.
So you see, one of the big things is transit time. From the time when you eat something to the time where you go to the toilet and get rid of that waste, it should be 24 hours or less.
Really, that quick?
Oh, yeah.
Wow.
And you see, people, you'll say to them, when's the last time you had a bowel movement? And it's been ages.
Yeah, like 3 months. And Dr. Schultz gives them this digestive formula, and I take this regularly. But what he says is you take it, the first day you take 1, and if you don't have a bowel movement, the second day you take 2. And if you don't have a bowel movement, the third day you take 3. And he said, you just keep doing that, and eventually you're going to have a bowel movement. And I got to tell you that I take 2 a day. I take 1 in the morning and 1 in the afternoon. And when it's time to go, it's like blasting caps, like you're saying. Okay, it's like I better be near a toilet because it's going to be running down my leg if I don't go.
It's time to go.
Yeah,
it's time to go.
Right.
Well, the transit time, and one of the things that I say, people have a problem with malabsorption syndrome. They'll eat stuff, and they've had so much gunk in their intestines for so long, and there's so much mucus that they could be eating good food or they could be taking vitamins, and they have a bit of a malabsorption syndrome, and the nutrition doesn't get properly absorbed. So from time to time, people do a colonic irrigation or a colonic cleanse or an intestinal liver gallbladder cleanse. I highly recommend those. Those are good for you.
I went and when I was in my 20s, I went to see this naturopathic doctor just because I wanted to. I didn't really feel unhealthy or anything, but I went to see this guy in Edmonton, and he was like in his 80s. He had a walker, and when he came to see me, and he did reflexology on my foot, and there was one spot on my foot that it was like, ouch, that hurts. And he told me I had gallstones, and they put me on this diet for 2 weeks. I had to fast for a couple days, and then I came, not for 2 weeks, it was for a week, and every day I had to go into their office, and they gave me this olive oil and lemon oil,
right?
And it was the nastiest stuff that, when you start eating that's the only thing you have, and you get this big old tablespoon, and 2 or 3 of them every 20 minutes, that kind of thing. And it's enough. But at night when I went home that day, it was like I had I could feel something, like right here is my gallbladder, and every once in a while, like gush, 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 gush. And so every once in a while, at night when I went to the bathroom the next time, it was amazing how all these stones were coming out of there, and it was quite amazing.
The combination of lemon juice and olive oil is an old gallbladder cleanse. I've done it. I do not particularly like doing it, but I like how I feel afterwards. Absolutely, for sure. It cleans out the pipes, and you get a whole new outlook on life. It makes a big difference, but you have to be careful and read up on it and pay attention, because your gallbladder is very important. If you don't have proper gallbladder function, you're going to have problems with digestion of fat-soluble vitamins, vitamin A and D and E, and those are absolutely critical. By the way, what's the percentage of cardiologists that take vitamin E, which is cardioprotective?
Probably very few. I mean, most doctors don't really do much about vitamins.
Oddly enough, 87% of cardiologists take vitamin E themselves.
Oh, really?
According to one study. How many recommend them to their patients?
Oh, that's a good question.
13%.
Wow.
So they know what's good. And I think what's good for the goose is good for the gander. But in medicine, it has to have a bottom line dollar amount.
And there's no money to be made in that kind of stuff.
There's no money to be made in that. Of all the bizarre things, approximately 100,000 people die every year from properly prescribed pharmaceuticals by a properly licensed medical doctor. And if you were to ask the medical board what's the greatest danger to the public health, without question they'd say naturopathic doctors.
Yeah.
They're out there.
Yeah.
What a joke.
Well, my attitude is that, the medical profession has its place. If you get run over by a truck and you need somebody to set your bones and stitch you up and put you back together. I mean, I don't know anybody that can do it better than like the medical profession. But people go to these medical doctors for things that they ought to really consider, like a chiropractor or a naturopath or something, like for issues like that. You know what I mean? That because the medical doctors, they want to sell their pharmaceuticals, and sometimes you have to do that, but sometimes that's there's other things that work way better.
Well, the interesting thing about medical doctors was when chiropractic came out, 1895 era, osteopathy came out just about the same time. And many medical doctors jumped ship and became chiropractors and osteopaths because modern medicine really did not have all that much to offer until the era of World War II, 1945, penicillin. Penicillin was such a profound adjunct to medical care that people lost all perspective, and they began to think you could fix anything, including a flat tire, with the proper amount of pharmaceuticals.
Yeah,
it's just not that way.
Well, and isn't penicillin basically bread mold?
It's bread mold, and it's the crystalline exudate of the mold. And the way it was discovered, Alexander Fleming looked at some mold, and he saw all around the mold no other microorganisms were growing. There was a zone around the mold. And he looked at it and he said, well, there must be something there that's preventing other microorganisms from growing. And he cultured bread mold and eventually purified penicillin. Penicillin was so rare that if they gave it to a soldier and it saved his life, they would collect his urine, and with tweezers, they would go through the urine, dried urine, and they would collect the little crystals of penicillin and use them again.
Wow, really?
Oh, it was
Damn.
a true breakthrough.
Wow.
And it was a wonderful breakthrough, but at the same time it was misleading because the generalization was made that anything can be fixed with the proper drugs. And that's just not true.
Yeah, I'm into alternative remedies. I like herbs and stuff, and Dr. Schultz's. I love that Dr. Schultz's. He's got some really, really powerful formulas that really work well, and so like I have that cayenne right there, the cayenne tincture that I use all the time, and so but there's nothing better than doing your own research and finding out alternative remedies. You told me earlier today that you used to teach speed reading. And so this book that this thing is taken from, I mean, he said that he read that in about 15 minutes, and it's quite a large book. Eh?
I had taught speed reading when I took the course Evelyn Wood Reading Dynamics, and JFK Kennedy took that course, and it became public knowledge. And the next thing you know, everybody wanted to learn speed reading. And I was one of the youngest instructors. And the important thing is to be able, if you have highly technical material, to be able to slow down for absorption. And if you have light, a novel or something like that, to go faster, to vary your speed according to the difficulty of the subject matter.
Yeah, I could see that because some stuff is just dry. it's hard to let it sink in.
Yeah,
You know.
yeah, it is. But getting back to the health aspect, if you want to have some fun, go to a dinner where there are a lot of doctors and notice how sickly they look.
Oh yeah, no doubt.
They look terrible.
Yeah, and I was looking at this chart here, like these bags under your eyes and stuff like that. You know, it's amazing how many people you see with bags under their eyes, and they say that's from lack of sleep. But obviously, it's more than just lack of sleep, then, isn't it?
Well, there's a correlation. When you are not sleeping, characteristically, you're upright. And if you're upright, your kidneys are not receiving the circulation that they would if you were laying prone.
Oh, really? Isn't that interesting?
And so you see the circles under the eyes, and they reflect kidney function. But, of course, they also reflect staying up, because when you stay up, you're standing up, or you're sitting up.
Right.
So if you examine closely, the diagnosis, the Chinese diagnosis is like 95% accurate. Every time I think that Chinese diagnosis is not accurate, guess what? It's me. I'm making a mistake. They are right on the money.
And they were right, but you were reading it wrong.
They were right, and I was reading it wrong. I found that the way, I started studying this in 1973.
Wow.
So that's 50 years.
Wow.
And for 50 years, I found them to be just absolutely remarkably accurate.
Yeah, well, it's encouraging. I don't really have any of those issues that you're talking about there, but it's amazing how you do notice those things in other people, though, for sure.
Oh, absolutely. And you can tell when somebody's healthy, and you can tell when they're really not well.
Right. There was another one here that I wanted to show everybody. I'm just trying to think of where it is. Oh, it's right here. This is an email that somebody sent me, talking about people texting and how their neck, it causes their posture. It affects their posture, and that can certainly affect you. And it can cause all sorts of issues. Like it says here, it can cause asthma, allergies, high blood pressure, multiple sclerosis. I know. Is that something? What do you have anything that you'd like to make comments about that?
Fascinating. Not 6 weeks ago, I had noticed how many people they're starting to develop a Dowagers Hump. Like a hump right at the top of their shoulders, because they're leaning forward, texting or writing or on their telephone all the time. And I mentioned it to my sister who had that, and I told her that I was starting to practice the ancient Japanese art of kendo, where they take the sword and they hold it with two hands.
Oh, I seen you doing that.
And they raise it up, and then they bring it down, and they raise it up, and they bring it down.
Well, that sword is pretty heavy, too.
The sword
is give you some good exercise.
Well, it stands you right up straight. The next thing I knew, my posture was better.
Oh, really?
My balance was better.
Isn't that? And that sword's pretty heavy.
Oh, yeah.
That thing's got to weigh probably, I bet you, 10 pounds.
Well, it's quite heavy. It really is.
Yeah.
So I told my sister about it. She's a nurse practitioner. She said, I'm going to practice. She looked around her house, and she couldn't find anything to use as a sword, but she found a pool noodle.
Pool noodle.
So I said, all right, you have to practice pool noodle kendo. So she started, and she said, 2 days later, she said much of the pain and stress and discomfort in her upper neck and shoulders had really resolved itself. So I recommend that people do some kind of vigorous exercise that is bilaterally symmetrical, left and right, and back and forth. And to bring that spine, it's critical to have a spine that's in alignment. Absolutely critical.
Yeah, and well, I don't do that much stuff on my phone. I do it on my computer, and so I don't know that I really have that kind of an issue, but I've seen it in other people. Like some people have what do they call it? Scoliosis.
They have scoliosis. Yeah, that's the saying is his back is as crooked as a dog's hind leg.
Yeah,
that's scoliosis.
Yeah, I know.
Yeah,
and some people it's not too obvious, but I've heard that as they get older, it becomes more and more obvious.
Well, as you age, the discs deteriorate, and you lose height and you get shorter, and then you really start to have problems if you have scoliosis.
Yeah, I know. I'm not sure that I'm getting shorter. I mean, I put my sister-in-law's homemade comfy salve on my back whenever I have an issue, and I can feel it swelling up in there,
Well,
So the discs, seem to come back with that stuff. But
you can experience the optimal human experience. You do the best you can. The Chinese say there's 5 factors that have to do with health. Number 1 is proper food. Number 2 is proper exercise. Number 3 is proper mental attitude.
Absolutely.
Number 4 is what was it? Proper mental attitude, food, exercise, and getting an occasional chiropractic adjustment or acupuncture treatment or massage or shiatsu, something like that. That makes a big difference. And it's really essential. If you are stressed, like our modern day lifestyle is stressful, go to a chiropractor or go to a massage therapist and say, work the kinks out for me.
Yeah,
it makes a big difference.
You were telling me a story about your son earlier today, about he had this cancer because of stress, because of oxidative stress. He was born with cancer.
Right.
Tell me that story again. I think that is just brilliant.
Well, it was back in the 1983, 1984 era when I was reading books on free radical pathology theory. And as you know, free radicals are quenched by vitamins. You have sulfoxide, hydroxyl, singlet oxygen. All these things circulate through your body. Have you ever seen a hose on a radiator in a car?
Oh, yeah.
When they're old, you see how they're cracked and all that?
They get cracked, yeah, right, and they'll break after a while.
That's free radical damage. And the same thing goes on inside of your body, except you have vitamins and things that act as antioxidants.
That's interesting. I never really thought of that. I figured it was basically, but yeah, you're right. It would be free. It's oxygen. Free radical is a oxygen atom that's free and wants to combine with something.
Right.
And it combines with anything it can. And so that would be free radical damage. You're right. I never thought of it that way, but you're right. That's exactly what it is.
Well, when you apply free radicals to human tissue, then you say there's free radical pathology.
Right.
And you know how white blood cells kill bacteria? They put hydroxyl on them. They put hydroxin, and it dissolves them.
Oh, really?
Yeah.
So it's basically something that attacks free radicals then, is that?
Well, your body uses a free radical solvent in order to attack bacteria and kill them.
Oh, is that right? That's interesting.
Yeah.
So tell us about your son. What happened? He had this cancer, and you started telling us about that.
Well, he was, my wife and I weren't getting along, and there was a lot of stress, and with stress, there comes adrenal hormones, and adrenal hormones are extremely pro-oxidative. They cause oxidation. And he was born with something called histiocytosis X, which is a form of immune disease. And I thought, he's not going to make it. And so
most people die like that, don't they?
Most of them do. So I hit the books, and with my speed reading skills, I studied everything I could. I read everything I could in Western medicine, Eastern medicine, free radical pathology theory, orthomolecular psychiatry, you name it, I studied it. And overall, I put together a formal model. And I said at the basis of everything, ultimately, is free radical pathology. And so I began feeding him large amounts of food with antioxidants, cooked carrots, vitamin C, lemons, oranges, grapefruit. And I gave him greens and things like that. And I included some synthetic antioxidants that you won't run across. Dilauryl thiodipropionate, diopropionic acid, butylated hydroxyanisole, butylated hydroxytoluene. All of these very powerful synthetic antioxidants to quench free radicals. And I made his food, and I made him plenty of brown rice and I made sure he got some of these synthetic antioxidants. And over the years, he survived, and he did very well. He became literally a world-class athlete. And years later, his brother, who was in medical school in second year, came to me and said, "Dad, my brother had Hans Christian Schiller's disease. He had, this horrible disease, but he survived. What did you do?" And I said, "You're the only person who recognized that I was responsible for your brother is surviving. And I said it was free radical pathology theory. I applied it, and the end result was he did extremely well.
That's amazing. And so, that is amazing. So that's, again, speed reading, I'm sure, came in handy because, you know, when you got a young family, you're pretty busy with taking care of the kids and doing everything else that has to be done. And so,
well,
you know.
I stuck with the speed reading, and I let my wife change the diapers. I told her I had something more important to do.
Yeah, no doubt, no doubt. Anyway, so this is talking about sleeping posture, and I can say that that I agree with this 100%. You need a good pillow, but you need to be in the right position. I think you'd just be comfortable, you know, and it'll probably take care of itself. But and then this one here is talking about head posture, and again, as being a chiropractor, you probably would know a lot about this.
When you look at the figure on the left, that person is standing straight up. The ear hole that you hear in is right over the tip of the shoulder. It's right over the tip of the hip. That is excellent posture. The significance of that is, if you look at the person on the right, can you see how when they breathe, the movement of their ribs would be impaired?
Yeah, really. Yeah, they wouldn't be able to take in a real good deep breath, would they?
They can't take in a real full deep breath, and they suffer from a relative hypoxia, not enough oxygen. And it's a stress because they're always trying to breathe, and their skeletal structure is working against them.
Right. Interesting.
So proper posture is very, very important. Very important.
So this is Dr. Joe's website, Optimal Human Experience. And I would encourage people, if they have any issues, if they're just concerned about generalized health, I'm sure that he would, give them some tips. Or I'll bet you there's a lot of stuff on your website for generalized health tips and things like that.
I've got 14, I believe, podcasts recorded.
Oh, really?
And I'm about to really go to work recording things about serotonin. People have serotonin problems. Serotonin is derived from tryptophan. That's the precursor. Tryptophan is in grass-fed beef, but there's no tryptophan in corn, which means that if you eat beef that is predominantly corn-fed, you're not going to have enough tryptophan, and you won't be able to produce enough serotonin.
Oh, really? So that's why the depression and all that stuff.
Well, you have the entire civilian population is borderline depressed, if not out and out depressed. I gave some grass-fed beef to a person who was depressed. 15 minutes later, they looked like you or I. It was shocking.
Wow, is there visual evidence in their face or anything?
Oh,
like
absolutely.
That?
You know, when people are healthy, they have a certain pink glow about them, and when they're not, they have a gray kind of pallor. You can tell when people are aging because they start looking more and more gray, and they get a deafferentation phenomenon in their brain. Their brain doesn't work as well. They start to go into cognitive decline. Right?
You always hear about these people that have dementia and stuff.
Well, I have a story about dementia.
What is it?
Well, a fellow brought me his wife one time, and he said, I think my wife has dementia. I want you to give her a full, thorough, complete, and exhaustive neurological exam. So I said, all right, we'll examine the cranial nerves and everything, you know. So I examined all the cranial nerves, and I went to him and I said, I can't find anything wrong. He said, what do you mean? I said, she's normal. All women are like that. And she didn't want to hear that, but, you know, I have to tell the truth. We are going to work with serotonin, and I'm going to give explicit instructions on how to improve your serotonin. We're going to work with dopamine, which is involved in motivation and
so these
success.
Are upcoming podcasts you're going to be putting up on your channel, on your website. Now, these are not YouTube videos, are they?
No, I don't believe so. They're going to be right on the Optimal Human Experience.
Okay, because that takes up a lot of memory and requires bandwidth, especially if a lot of people start watching those videos and stuff like that. You know, that's why I like using YouTube. Of course, you have to be politically correct. I don't think we've done anything that's not politically correct today, but but you have to be politically correct, or YouTube will take your videos down. They've taken my channel down twice.
Oh, I'm sure.
Yeah.
Yeah, you're controversial.
Yeah. So, but so at any rate, I've been trying to talk Joe into getting a YouTube channel going, because then he could upload more podcasts. But in the meanwhile, he does have them on his website right here, podcasts and videos. And so I would recommend you checking them out, because I think you'll find them enlightening, and some really good, basic common sense ideas on what you can do to improve your health. And you got to just think outside the box and do your own research. And I always do my own research, and I have people I contact that if I have any questions. But is there anything else you'd like to say, Joe?
I absolutely guarantee you, if you get a little information on how to improve your serotonin levels, your epinephrine, norepinephrine, dopamine, oxytocin, all of these things are going to make a profound improvement in your life and health. And my goal is to help everyone experience the
optimal human experience.
Optimal human experience. And it's all natural. That's what I like to work with.
I've always had the idea that you create your own reality. And so if things are real dreary, I mean, it's hard to be optimist and when things are but I don't know that I really do anything that improves my serotonin. But I'm into, like, I take vitamins. I have packets of vitamins. Joe sees them here next to my laptop.
The desk is strewn with nutritional supplementation. You don't do much to.
No, that's right. I do quite a bit of that, and so.
You're pretty cheerful most of the time.
And oh yeah, sure. Yeah. I don't notice that I don't consider myself depressed at all.
No.
I if anything, I just get mad.
Right. Oh, I've never seen you happier than when you're writing your legal documents with the expectation that they'll cause us consternation and when they're received.
There you go. And there's nothing like a good belly laugh, I mean, that is food for the soul, is just to have and when Joe, sometimes he cracks his jokes and stuff like that, and that just gets me going, I'll tell you.
Well, you know why Jewish people never get cancer?
No, why?
Well, because they're all Hasidic.
Hasidic.
You have to have a certain alkaline base, but they're all Hasidic.
Hasidic, that's right.
So, well, God bless America.
All right. Well, thanks for watching, everybody, and check out Joe's website, and if you have any comments or something, I can pass them on to him. Anyways, take care, and thanks for watching.